YouTube is live. Alright, YouTube is live.
You want to turn on the phone, we can watch too?
Yes.
Yeah, I can see.
Alright.
Yeah, I can see. It's good.
Stop. There we go. Alright. Facebook is live and YouTube is live. Alright, let's start.
Yeah, I put the phone here so I can watch.
Alright, let's get started.
Hi guys, welcome to our show Truth with T. My name is Dr. Kumar Vadivel. I'm a board certified periodontist and we practice dental implants, oral surgery and periodontology in our practice, and we got a lot of followers for our show, and we are very glad to have you here tonight. And so we got a lot of questions being submitted from Facebook, our website, thetruthwithteeth.com, and our practice website, implantsandgumcare.com, and also the Instagram and then Facebook. So we got a lot of questions that we got to cover. I'm very excited to just have you here online tonight, and we look forward to getting started and hopefully rock on the show. Thank you.
Alright, so let's just dive right in. Our first question comes from Facebook, and it is from Sandra Clark Wilson. Her question is, I want to know, is a full mouth implant safe?
So the question is full mouth implant safe? What this follower is asking is having a mouth full of implants, which is safe. So the answer is definitely the answer is yes. Why would the person need an implant to begin with? For example, if the patient had a lot of infected teeth, a full mouth of infected teeth, and you definitely don't want to have any infection in your mouth, so definitely not having infection in your mouth is not safe at all. So you definitely want to have those infected teeth removed. So after you get those infected teeth removed, and one of the best way to replace those teeth are of course the dental implants, and now you're going to have full mouth of dental implants, and it could be as simple as minimum as 2 implants on the bottom jaw and 2 implants on the upper jaw, or it could be as maximum as about 6 to 8 implants per jaw. That means 6 to 8 implants on the bottom, and then 6 to 8 implants on the top also. So that depends on the type of prosthesis that you want to have in your mouth, whether you want to have something removable or you want to have something fixed. So the bottom line is having a full mouth implant is safe. I would rather prefer to have somebody have a full mouth of implant versus a full mouth of infection, which is not good for you at all. And I hope this answers your question.
Yeah, implants are perfectly safe. Alright, next question. Let's go to our website for it. And it comes from Mike. His question is, do you remove implants if needed, and does the free consult cover that procedure? Bottom right molar is about 10 years old.
So the question is, do you remove implants if needed, and does the free consult cover the procedure? And it is a bottom right implant, molar implant, and which is about 10 years old. So to answer your question, we do remove implants in our office. The question would be, why would you need to have the implant removed? So if the implant is badly infected or the implant is badly broken, and if nothing can be done to salvage the situation, yes, of course, that implant need to be removed. Yes, we can do a free consult for you in our office to cover that procedure, whether it is a bottom right implant or implant in any part of your mouth. However, without seeing the implant, I can't really tell you whether it is a broken implant or a failing implant that cannot be salvaged. But what I can tell you is a lot of times that we see patients in our office, they think the implant is failing, but when they come to our office, we are able to salvage the implants, and we do a variety of procedures, including one of the most innovative procedures we do in our office is the laser therapy around the implants, and particularly the laser therapy for the failing implants. Particularly if you are going to have a prosthesis that is holding onto those implants, and you don't want to definitely lose those implants, end up not having to have a good prosthesis in your mouth that is not staying well. So if you do have a problem with the implant, before you even consider removing, come and see us for a consultation, whether we can help you salvage the implant using some kind of a laser therapy or some kind of a periodontal gum procedure, or if we have to remove the implant, and we highly recommend we do the bone grafting also at that time. So any kind of procedure related to either a failed implant or a broken implant, we'll be glad to help you.
All right. Let's go to Instagram for our next question. This one comes from Jose Saravia. His question is, I am a poor person who has a problem with my teeth. You can elude me?
So I'm a poor person who has problem with my teeth, and how can you help me? And that is what this person is asking. So we are here to help you, and we can definitely help you in any regards we can. For those patients, sometimes who cannot afford even for a consultation, in our office we offer a free consultation and a free CAT scan. So if you are a poor person and if you want some help, at least with a consultation, you can come to our office. But when it comes to treatment, even if you think that you cannot afford for the implant, after coming in here, sometimes we have some options for you to just some kind of a payment plan option that we are able to get you in. So if that is the case, we will be able to help you because we are a for-profit organization here. However, we do have some tie-up with some non-profit organizations also. Sometimes we do run some non-profit events here, some free events in our office too. So we can put your name on the waiting list to have you come in for one of those events to have the teeth removed. Or we can definitely recommend you to places that we know of that you can get the dental work at a very, very affordable price. So definitely consider coming to our office, or if you, one of the places that we know of in the Dallas-Fort Worth area is the dental school in Baylor. They have extractions they do as minimal as about, to my knowledge, it's about $25 to $30 per tooth. And so you can definitely weigh those options if you have a tight budget that you're working with. And there are many places in the Dallas-Fort Worth area, they do offer a non-profit type of treatment. So you can explore, and then we'll be glad to recommend you to some of those places. Once you come in for a consult, we can definitely help you.
Yep, and if you come for that consult, we can at least get you that treatment plan so you know exactly what you need done.
Yes, sir. You got it.
All right. Next question, back to Facebook. This one comes from Brittany Busey. Her question is, can I get implants if my lower jawbone was removed and replaced with a metal plate?
So the question is, can I get implants if my lower jawbone was removed and replaced with the metal plate? So the reason this follower is asking this question, because sometimes people have some certain conditions, either some cancer or other type of conditions, other type of diseases. You need to have a part of the lower jawbone or upper jawbone removed. In those instances, your jawbone is replaced with some type of metal, then that prevents you from getting some type of implants. So our goal will be to, anytime you have those type of cancer or other diseases, our goal is to be able to save your life, and that's the reason why we are not that concerned about the teeth at the time of the reconstruction. However, after having the reconstruction made, and if there is a way possible, then depending on whether you have any bone available at all, or even if there is any type of attachment that can be done to the other metal plates that you already have, so those are the type of options that you might have. Again, without seeing you, I may not be able to help you, and this is a great question that you might need to ask your prosthodontist whenever you go see the prosthodontist, if you still have a relationship with them, or the reconstruction surgeon, whoever did that. More than likely it could be your ENT surgeon or your oral maxillofacial surgeon. If you had those people who helped you with doing the reconstruction to begin with, I'm sure they probably have some kind of an option you will be able to consider to replace your teeth with dental implants. So again, get a consultation, go talk to the team who did the reconstruction for you whenever you had that jawbone removed, and they should definitely be able to help you with some kind of an option that is possibly available.
Yep. All right, let's move on. Let's go to a question from Cora. This question is, can dental implants be removed and cleaned like dentures? Do dental implants require more care and maintenance when compared with dentures?
So the question is, can dental implant be removed and cleaned like dentures? Do dental implants require more care and maintenance when compared with dentures? So it's a two-part question. The first part is, can dental implants be removed and cleaned like dentures? What the follower may be referring to is, looks like whenever you have the dental implants or dental implant retained prostheses, we call them. For example, this one right here. So this is a dental implant retained prosthesis, and this is a regular denture right here. So the regular denture works like this. So you just remove it, and you clean the denture, and you clean it with some clean water, or maybe with some denture solution, and then you put it back. But when you have those implants kind of snap on like this. How much you can see, but here, see, they don't come out just like the regular denture. Reese, can you hold that?
Yeah.
See, we can compare. See here? So they come out like that, but here, so you have a little bit of a grip. So when you have that, so you got to really pull them out. Once you take them out, you have those implants like this. So it is not a matter of removing those implants, but once you remove the dentures, yes, you should be able to clean around those implants. So the answer to your question is yes. You don't need to necessarily remove the whole implant to clean it, because the implants are inserted into the bone. But you can definitely, after removing the denture, you should be able to clean around those implants. So the second part of the question, do dental implants require more care and maintenance when compared with dentures? Yes, they do require more care. For example, when you remove the denture, so all you have to do is to kind of clean it with some water and with a regular toothbrush. And when you put them, you can put them on a denture cleaning solution, and you can put them back in your mouth. But whenever you have implants require some brushing. And when patients with dental implants, they come to our office, we show them kind of a different techniques, and particularly give them different kind of tools like special toothbrushes and things like that to remove the implant, to care for the implant. If you don't care for the implants are going to fail. Implants, as you know, they are a huge investment that you're making, and you don't want the implant to fail. So the ways that you care for the implants, you do two things. One, you return to your dentist for professional cleanings. I recommend cleanings around the implants as minimal as at least about 3 months. And then also you need to use those special tools such as the regular toothbrushes, and we call them sulcus brushes or end-tufted toothbrushes. You need to use those toothbrushes to be able to care for those implants and then clean around the implants. That way your investment is going to last as long as possible. And I hope this answers your question.
All right, let's do another question from Quora. How many teeth can be replaced with dental implants? Minimum and maximum teeth.
So the question is, how many teeth can be replaced with dental implants, minimum and maximum teeth? So the answer is, excuse me. So the number of teeth we usually use in our mouth is about 32 teeth, and most patients will have their wisdom teeth removed, so usually have about 28 teeth. So when you do a full mouth reconstruction, we don't replace all the 28 teeth. We replace about 24 teeth, which is 12 teeth on the top and 12 teeth on the bottom. So the maximum number of teeth that can be replaced, the range is anywhere between about 12 to 14 teeth on the top, but we usually replace only 12 teeth on the top and then 12 teeth on the bottom. That is the maximum number of teeth that can be replaced. The minimum number of teeth that can be replaced are at least a minimum of one. For example, if you just lost one sixth, so the minimum number of implant will be at least one implant. So the answer will be, you can have as minimal as one implant, or you can have as maximum as about 12 teeth on the implants. Looks like we have some technical difficulty here.